So this is my disclosure slide. So a couple things. I'm a hematologist oncologist like Dr. Jatoy. My main interest is in lymphoma. I do have more than a casual interest in nutrition, but I will tell you that I'm not an endocrinologist, nor do I specialize in this area. I feel strongly that they're quite important for patients. The agents I'm going to be talking to you about today are very inexpensive, and thus even small benefits in survival or morbidity would be very important. And I've become aware of how difficult this research is, and I'm going to explain a little bit of that today. And my last disclosure is I do take vitamin D, but even though I'm talking about it today, I'm by it myself. And I want you to know also there's a separate vitamin D talk coming up from Dr. Kennel, who's an endocrinologist who will probably go into more depth about vitamin D in general. So I'm going to focus mainly on just the area of lymphoma. So this is my first question. Vitamin D insufficiency or low levels in lymphoma patients is, number one, associated with an inferior survival. Number two, predicts non-response to initial therapy. If replaced, can change outcome. Is not seen in other countries. In other words, it's unique to the upper Midwest. So go ahead and take a stab at those before I give my talk, and they'll kind of give you some awareness of what we're going to be talking about. Okay, looks like most of you have answered here. Okay, good. We have some things to talk about a little bit, and I think this will become clear as I go through my talk. The right answer is it's associated with an inferior survival. The next question relates to my second part of my talk, which is on magnesium. The optimum range for a serum magnesium for outcome in cardiology and lymphoma is, number one, the normal laboratory range, at least at Mayo Clinic, of 1.7 to 2.6 nanograms per ml. 2.0 nanograms per ml. It's easy to measure but difficult to correct, or is it hard to measure and easy to correct? Go ahead and start answering that. Okay. All right. We'll talk about that. The right answer is 2. You know, probably number 3 is, we can talk about that. It's probably right also, now the more I look at it. Okay, so the issues I'm going to be speaking about, vitamin D, magnesium, the cancer data. I want to differentiate between supplement and replacement and why that's important. And I want to talk about the levels, and do levels matter?